o'clock, we'll go ahead and call the Community Health Board meeting to order. And first on the agenda would be approval of the agenda. Any additions, corrections? Turn the microphone on. Any additions or corrections? Otherwise, I'll look for a motion to approve the agenda.
Mr. Chair, I move that we approve the agenda.
Do I hear a second?
Second.
Second from Commissioner Sumner. Any discussion? All in favor of approving the agenda, please say aye.
Aye.
Aye. Any opposed? Motion carried 4-0. And the next item would be the approval of the minutes. Everybody should have a copy of the minutes in their packets. Any changes or corrections to the minutes?
Mr. Chair, I move that we approve the minutes from the last meeting.
Okay, we have a motion by Commissioner Carlson to approve the minutes. Do I hear a second? Oh, yeah.
Second.
Second by Commissioner Sumner. Thank you. All in favor of approving the minutes from the previous meeting on October 15th, say aye.
Aye.
Aye. Any opposed? Motion carries. Introductions and overview. Amy, take it away.
Okay. All right. Well, welcome to our first Community Health Board meeting of the year. And hopefully I won't get your names mixed up because now you guys have all messed me up and switched spots. So that's what I think I'm most nervous about today.
Yeah.
What's that?
The nameplates are.
I know, but it just makes me nervous. Like, what if I say your name wrong? So anyway, welcome to the first Community Health Board meeting of 2025. Commissioner Scott Wigner, thank you for joining us. Hopefully you find today educational along with the rest of the commissioners. You haven't had a presentation like this since 2023 when my predecessor did kind of a public health 101. So I thought this would be a good time having a new commissioner, having some new roles, just giving you a little bit of background on our Community Health Board. And so let's get started. I'm Amy Bowles. I am your Public Health Director, but I do serve in two roles. So I also serve as your Community Health Board Administrator. So the direct title under that position is Community Health Services Administrator. And we are going to get us started with a PowerPoint to help kind of guide our conversation. So on the first page of your PowerPoint, you're going to see the grade emblem for the county. I think it's really important for us to understand that while we are the Community Health Board meeting, right, you are the individuals that appoint me to do the work of the Community Health Board. I am serving you as an employee of the county. Okay, so it gets a little tricky, but in our org chart, we have Health and Human Services, and I report to Ann Linseth. She's my director, but I report to you directly as the Community Health Board, and not a voting privilege type of way, but more so in a funding capacity, updating you on the general health of our community. Okay. So then our next slide. Can I let you control it? That says it's on. There you go, Public Health 101. So even though we're the Community Health Board, I wanted to remind you that while we meet as a Community Health Board, public health is really responsible for carrying out the duties, the day-to-day services, and the work of the Community Health Board. All right, so the first thing that I want you to know is that Minnesota Local Public Health Act 145A is our governing structure for the Community Health Board and for public health. This gives us the musts and the shoulds and the things that we do, the things that the law requires of us. It gives us our definition that a Community Health Board has the general responsibility for development and maintenance of a system of community health services. It gives us the duties of identifying the local public health priorities implementing activities and addressing those priorities, assuring an adequate local public health infrastructure, preventing the spread of communicable disease, preparing for emergencies, responding and assisting in the recovery of those emergencies, identifying gaps and barriers, and submitting to the Commissioner of Health our community health assessment and our community health improvement plan. Now, I could probably read to you for the next half hour a list of our musts and our shoulds and the things that we're responsible for. But it's also my job to condense all the things that I've learned in the last 2 years into a very condensed, shortened summary. So that's my summary of Law 145A. I would encourage you to take some time to breeze through it so you understand why I come before you quarterly and how that my role differentiates to you between the public health director and your community health systems administrator. Another really cool thing about our public health is that we're operated by a single community health board. Now, in our state, we have several community health boards because by law, we're required to be part of one. You can choose as a county to be part of several counties and then have a multi-county community health board, or like ourselves, we can have one county running our community health board. And I'll get more into that a little bit later on the next slide. Just for point of reference, in 2015, we separated from a multi-county community health board, at which time we were part of North Country Community Health Board, which was Lake of the Woods, Clearwater, and Hubbard County. And so those 3 counties still operate as a multi-county community health board, but we operate as a single community health board. Another important thing to understand about our community health board is that funding comes into us through multiple grants or through partnerships. So I've listed on your PowerPoint just half of our grants, some of the big ones that you may have heard of, like WIC, our Women's and Infants and Children's Program, or TANF, which is Temporary Assistance for Needy Families. Now, it's important for you to understand that TANF, you may hear Kurt, one of my partners over at Health and Human Services, he runs the Economic Assistance Division. He also has a TANF program. Our TANF program funds our family home visiting program. Other programs that we have that fund our family home visiting programs are called Strong Foundations, or our MCH Title V, or like a partnership grant that we have with Sanford through HRSA, where we have a program that we run called Families First.
Strong or strang?
Strong. Did I type it wrong in here?
Yeah.
Oh, good catch.
I thought that was.
When I was running through this on Saturday, I caught a couple typos and I thought I got them all corrected. So I appreciate you seeking that clarification. It is kind of a strange program, actually. So
like either we gotta add an E or we're gonna change it.
no, it's actually, I'm really glad you actually said that, because so that grant we actually share with North Country for our fidelity purposes. North Country Community Health Board. So we have a funding stream that funds that grant, but that grant requires us to use an evidence-based model and to meet fidelity, like saying that you do all of these lists of there's 200 things that could be towards fidelity, like meeting these standards of practice. Well, we share that part of the grant with North Country, so we don't have to do those pieces alone, which is a really good thing for us, that we're lucky to have that partnership.
Kind of dollars are we talking about for the entire grant that we put roughly?
Strong Foundations, I believe, brings in like 160 a year, 160,000.
And that split between the two of us?
No, that's just for our share. Yep. Then we give them a small amount, like a contractor's fee, to help with that fidelity piece of it.
Oh, so it's not a 50-50 split between us and North Carolina?
No, they have their own funding stream for that particular grant. Other grants like SHIP, the State Health Improvement Plan grant, that one comes in through North Country and we're a partner in it. We don't get any funding for that one. But then like another grant that we had, the innovation grant that we just took on this year, which I'm going to show you some of the really cool things that we've done with that grant. That grant comes into North Country, but we split the work with that grant. So It just kind of depends on if the grant comes into the community health board, or if the grant comes into public health, or if it's a grant that we have a partnership with an agency like Sanford or another community health board.
Great, thank you.
Okay. Do you have any more questions on the funding piece before I go on?
Commissioner Carlson, another question?
You do.
Mr. Chair, so as long as we're on the subject,
Yeah.
what determines whether we're going to be in a partnership with North Country or do it on our own? It just seems a little,
We
Yeah.
get to decide that. So some of our grants, when we divided in 2015, we just took them on because we're a single CHB. But a grant like SHIP, it's not a lot of squeeze for the juice. Is that the right way to say it? So there's not a lot of money for all the work that we have to do. So in my opinion, North Country was very gracious and said, we'll keep the grant, we'll do all the work, but we'll make you a partner so your county will still benefit from the work of this grant. So for example, one of the things that came out of that grant cost me no time and no money because they did the work, was the safe walking path on, I'm going to get my street mixed up, First Street by Lincoln Elementary. They put in like some better traffic cones to guide traffic because it's a heavy traveled area for elementary kids. I think it's Lincoln Elementary. That might be a Fargo school. Does that answer your question? Okay. I can give you one other example, the innovation grant that I was talking about that I'm going to give you more information on later. That grant required a partnership between two CHBs. The state said, we want to see what it looks like to have two non-joined CHBs work together. What kind of hurdles does it create? What kind of successes do they have? And so North Country said, hey, we'd like to apply for this grant. Would you like to be a partner? Sure, why not? Good question. Any more funding questions before I move on? Okay. All right. Then two more things that we're required to do under the state statute and that fall under public health and the CHB duties. So the annual reporting. Once every year, I report out to the state on the work that we did the previous year. I'm going to give you a little more detail about this later on. I just am putting it in the context of this slide so you understand that this falls under public health, but I report to the CHB on the work that we're doing. Okay. And then the same thing is for the community health assessment and the community health improvement plan referenced as the CHB. That's the responsibility of the community health board, but because I serve you in two roles, I can get that work done as my role as the director also. Okay. Any more questions on this slide before I move on? Okay. I just don't want to push it too many times and then it, okay. Oh, that was weird. Okay, so the next thing I want to talk to you about is that annual reporting. The annual reporting that I do at the beginning of each year for the work that we did the year prior is based on this model. So this model just went live last year. This is called Public Health Foundational Responsibilities. In our responsibilities, we have our areas and our capabilities that we're responsible for. So I'm a visual person, and I know I did this at a previous meeting, but I'm going to paint this picture again for you because when I'm talking about communicable disease or equity or emergency preparedness or access and linkage to clinical care, I want you to understand why we're putting so much focus into those buckets, because it's our responsibility to do that work. So the top half is our foundational areas. If you could think about this like the foundation of your house, right? You have your cement and all of your things that make up that cement to make it a good foundation so it can hold up the walls to your house should be in those top 5 areas. Your communicable disease, chronic disease, your environment, your maternal child health, and your access and linkage to clinical care. Then once you have a good foundation, it's safe to put the walls up. And when you put the walls up, you put in a bathroom and a kitchen and a living room. Well, that's the same way that these other 8 boxes work. These are all the rooms in our house, and we do different things in those categories. And sometimes they overlap, right? Like sometimes you have a door that goes from one room to the next because you use the kitchen and the living room when you sit down to have a dinner, right? That's the same way that we can put some of these other buckets together. Like we might look at how equity impacts emergency preparedness and response, or we might say, while we're doing communications, how do we do that well in emergency preparedness and response? Okay. Some of the things that we do in these buckets or things that we may like to do, I'm just going to give you a quick little rundown. We work super hard on partnerships. We build partnerships with local emergency management systems, with mental health youth services, or other partners or organizations in town that can help, that we can help foster the work that they're doing. We coordinate with community and facilitated listening sessions and surveys. So like when we did our community health assessment, it was pretty simple, right? The survey that we put out, but it was an opportunity for us to gather at community events and gather input from people. We've worked really hard in developing a robust communication plan. I'm going to show you some of the results of what we've been doing a little bit later. We have developed and updated and been working on our emergency response plan, and we have some planning in the works for training for staff. We've been looking at health equity and ensuring how are we doing, making sure that we're not just focusing on one of these buckets, but that everybody has access and public health protection regardless of where they live in our county. We are establishing a system to move from paper to electronics. So all of our documents and assessments and things that we do in our clinic and out in the homes, we're trying to move that to an electronic system. So we're not having a ton of papers floating around. And then we've also been working on cross-jurisdictional sharing with other CHBs, not just in our region, but across the state. And so that's been a really cool opportunity. Any questions on that model? Okay. Yes. So excited. Okay, so now I want to talk a little bit about support. Support comes in 3 levels for our community health board and our public health system. You've got kind of our 3 primary ones there for federal. In addition, I also want to mention HRSA. HRSA is the Health Resource and Service Administration organization. It is a federal organization where grants can go directly to entities or to individuals. So somebody could apply for like a student loan repayment through HRSA, or an agency like Sanford applied for a $3.2 million grant and then shared that among community partners for the work with rural moms and children. For our state, we really lean into Minnesota Department of Health for our funding streams. We lean into local public health association for a lot of our policies and procedures. And then the one that I'm very fond of is SHAC. That is our State Community Health Service Advisory Committee. While the other 2 are really important, that one has become a favorite of mine over the last 2 years because it is a way for us to bring all of those organizations together. So you have local public health, you have MDH, you have the local public health association, and you have elected officials like yourself or members of community health boards. And I think that's so important because it gives us an opportunity to learn from each other and hear about things that you're doing, but hear about things that we're doing. And we talk about it at a state level, but we also talk about it at a local level. And then I'm the second right now. Mm-hmm. Yep. And we can change that at any time. Historically, we've always had 2. Commissioner Anderson had asked if I'd be interested in joining, and I was, but I would be very happy to have another commissioner represent and be a second if you would so choose to do that, just so you know.
Mr.
Okay.
Chair, So yeah, I was the appointee or the delegate to SHAC, and then
And then,
Commissioner Gould took it over. But my time on SHAC, I observed Amy and how well she does her job, attending these SHAC meetings. And then I know that the leadership at SHAC really taps into her knowledge. So I mean, I think uh, you know, it's in our best interest that, Amy, continues to be the second SHAC member.
Amy, were you saying that if one of us added, so Commissioner Gould and Commissioner Sumner, Winger, or whoever, would you have to step down, or are we only allowed to?
We're only allowed to.
Okay.
Yep.
Thank you.
And then local. So our local support comes from commissioners and elected officials like yourself, our partnerships and our collaborations, and then our communities and our residents. And, when I was looking at making that list, I was like, I could only come with 2. And then I'm like, how could I even forget our community and our residents? Because that's the very people that we serve. One other organization you won't see on your PowerPoint is DHS. And I didn't intentionally omit them. DHS has a very small role in our CHB in public health. We have one grant that kind of trickles from them, but they give it to MDH and then MDH administers it. So that's why I really consider our lead person MDH as far as our lead organization.
Amy, what about the new department, Children, Health and Families? Does that factor into our community health board or not really?
Not a lot. I did sign up for like their email, like you can sign up for emails from the different departments. So I can kind of keep tabs on it, but I really feel that the new children's department really focuses more on social service. I think, Anne, can I say, like, you've been following them too, and would you agree that they fall more to social service work right now? Yeah.
Thanks.
Just want to make sure I wasn't speaking out of turn.
Them dividing into the 3 buckets or whatever, it's a good question.
Yeah, great question. Okay, any other questions on that slide? Yeah,
On the federal and state,
yep.
and it's support, is that financial support or is it more informational?
Either. So MDH is primarily our financial support. An organization like the local Public Health Association, you could say they give us a little financial support because sometimes they'll pass funding on to us to do trainings or travel out of state for national conventions. But for the most part, MDH is financial, local Public Health Association is more our legislative, and educational information. Yeah, good question. Good. Okay. Keep going. All right, so here's the one I was going to tell you a little bit about our project that we've been working on with North Country. So the reason that I strategically put in some of those logos or graphics at the beginning is because I need to remind us that you'll see different things, different pictures, and they all represent different work that we do. So while we're under the county umbrella and the county is our logo, right, and is our boss, we have created a community health board graphic, not a logo, but a graphic for the work that these 4 agencies or 4 groups of buckets of people are doing together. So the first one is our community health board, because we're a partner in this grant. Then there's the North Country Community Health Services. And so that's the 3 other counties that I mentioned, Lake of the Woods, Clearwater, and Hubbard. And then MDH, because they're the funder. And then I would be remiss and lost if I didn't take this opportunity to mention Emergency Management Chris, as our PIO and emergency manager, has been instrumental in helping making sure that our communication stuff has been going off without a glitch, that I'm not breaking any rules, and that we are being equitable to our community, and that the things that we're saying, we're giving good, wholesome education, right? That we're giving facts. So Diane, are you able to bring up our website? Okay. So there's two things that we've been working on through this grant. And without Diane's help, this would not have been possible to make this public on our website. I honestly, Diane, I don't have the capacity or the knowledge how to build a website. I could learn, right? I'm always want to be teachable. But on our website, if you go to the public health page, all the stuff that we've been working on creating, and it's not all on here yet because I'm making sure that I'm like, editing it. I don't want to put anything up there that's not correct. But Diane has helped us create a public health library. So if you go to the public health library, you're going to see buckets of topics. So could you go ahead and click on the safety and security tab, Diane? So any topic that falls under more than one topic, you will see in any topic that you click on. So for example, holiday safety tips. If you click on that, that will bring up a document that's free, and any community member or community organization in our community, or that has any person on the face of the planet that has internet can use this document. And so let's say now we put this here, but somebody happened to be under family health. Because it's also a family topic, we can tag it under multiple categories. Then can you go to the media tab, Diane? And so when you have a moment, just go and click around in there and you'll see some of the documents and the education that we've created. One of the other things that we've created is a YouTube channel for the Community Health Board. And so on that page, you will see our educational library of videos. And then we have one new one that actually Chris is on, and he is our primary moderator for that on emergency safety in the winter time. And we are also going to be publishing our meetings on this YouTube channel too. So we'll keep them separate to kind of help differentiate them. Okay, so back to my PowerPoint. I wanted to talk a little bit about 2024 and some of the things that we've done so you know how they've fallen under the Community Health Board. We've added some additional funding streams. We've had some great policy changes that have improved the work that we do and improved the services that we're able to provide for our community. We've done a remodel to improve the space for our clinic. So now when children come in and they are here for a WIC appointment, they have a separate room that's their kind of their exam room. And then they have a safe room where they can go in with their parents, or they can stay out in the lobby in a play area and play while our dietitians do their assessment and clinic visit with our clients. We've had some increase in partnerships at the state, regional, and local level. And I do want to take a moment to share one with you that's actually at the federal level. So I just want the CHB to know that I put in an application for the National Council of Mental Wellbeing. It's located in Washington, D.C., to be part of their cohort for behavioral health training and institute. So throughout the next couple of months, I will be attending a lot of several virtual trainings for behavioral health and substance use. But then in May, they're sending us out to Philadelphia for 2-day in-person training on behavioral health and substance use, followed by 3 days of the largest conference that takes place in the United States for mental health. So I'm pretty excited about that. And then to kind of close out 24, you can see that you did graciously approve a community health worker, an account tech, and one of our nurses is operating under her job title as a public health nurse, but we've focused her work on community health, and that has been huge. So I'm going to take a deep breath, take a few minutes, and I'm gonna actually give Chris the podium because I thought this was a great opportunity for him to talk, for you to hear from Chris about the work that we've been partnering on instead of just hearing about it from me. Thank you, Chris.
Go from small to big. We need to make some adjustments here, so. Good afternoon, Chris Muller, Beltrami County Emergency Management Director, PIO. I knew I was in trouble on Saturday when Amy called me, and it wasn't to go get a margarita, that she had some work for me to do, so. Over the last couple of years, we've really developed this positive working relationship with public health and emergency management. Obviously, the 4-year nightmare of COVID, we had to work together. I don't think anybody truly enjoyed doing the work we had to do, but we did enjoy each other's company. So what did I say? You're my 6th public health director that I've worked with, and they've all been fantastic, but we've been able to accomplish a lot together. Some of the things that we've done as both entities is we both have grant requirements for similar activities, and we can integrate those together. 2 birds, 1 stone, and we share resources. We also have a better alignment of county response priorities and clear understanding of whose responsibility is what. I think that became pretty evident during the Red Pine Estates crisis when those residents were displaced and the following response to that. I was also able to join, not necessarily through public health, but as part of Health and Human Services, the Housing Collaborative. That's been an eye-opener for me personally to see the challenges that we have in our community and also being prepared for if that happens again. It's not a big secret that emergency management, we have a lot of mandates that we have to do, a lot of work that we get accomplished through grants. In the end, we are still underfunded. Some of my contributions are reimbursed out of the Public Health Emergency Preparedness Grant that offsets the costs from the general fund. There's more flexibility in the public health emergency preparedness funding, procuring equipment for exercises and resources. You know, this might sound like I, like to play with little toys and cars in my office, but I was actually able to get an exercise kit and have a bunch of little emergency response vehicles so that when we have an exercise, the fire department can have all of theirs lined up here. The cops and the sheriffs can be parked at Perkins, and then everybody else will be where they need to go. And when we have our disaster, we can simulate the response with all those emergency vehicles and ambulances.
You didn't say Dunkin' Donuts.
What's that?
I said, at least you didn't say Dunkin' Donuts.
Well, probably there too. One of the largest projects that we accomplished, and I very much thank Amy in thinking outside of her box, is she knows how much emergency management supported public health during COVID. And with the work that I've been assisting her with, she says, what is your #1 need? And I said, we need new technology in our emergency operations center. We had a little camera that we'd have to plug in through the USB, position it, and half the time it would fall off during the middle of the meeting. And we only had 1 speaker. You couldn't hear anything in the room. People were always talking over each other. But now, Commissioner Carlson and Gosvig, you had the opportunity to see it firsthand. We've got new equipment in there. We got speakers and microphones throughout the room, as well as a camera that nobody can touch because it's from the ceiling, that we don't have to worry about getting broken. We both participate in the Northwest Health Coalition. Both emergency management and public health emergency preparedness are critical partners in planning and response, not only for our county, but also our neighboring communities in our region. Probably the biggest project we're working on now is we are partnering on an upcoming shelter training and exercise. Public Health Emergency Preparedness will be sponsoring the event, working with a working breakfast and lunch with instructors from the American Red Cross at the Sanford Center. We've been trying to do this for years, and we were just about to do this when COVID started. And obviously we've had a 5-year pause since then. Amy and I have been working aggressively with the Red Cross to get this to happen. We're excited, April 22nd and 23rd. Okay. So you guys are all welcome to attend either the training or the exercise. We have a pretty good lunch, I will say. So if that entices you for a free lunch, come on by. But the cool thing about that is we're going to get exercise players that are going to be people that need to be sheltered. Our scenario is going to be a wildfire, and this was decided before the devastating fire in the LA area. Because as part of the hazard vulnerability analysis, this wildfire was our number one identified natural hazard. So we're going to be using that as our scenario. So we're going to have people that have different needs that we're going to press the players and having to assist them. We promote community preparedness. As Amy said, there's now a library online that has a bunch of videos and materials that we're going to continue to add additional stuff over the coming years. And one thing that we've done is we want to reach everybody. We know that's impossible. Not everybody has Facebook. Not everybody's on YouTube. Obviously, not everybody comes to the CHB meeting, but we want to reach everybody. And one thing that we did this year is we went and found a new demographic and a new group of people. We attended the Pride event and we must have visited with 400 or 500 people. And so we were able to hand out emergency management, emergency preparedness stuff, and it is a pleasure working with Amy. Any questions for me? All righty, thank you.
Thank you very much, Chris.
Thank you, Chris.
You're welcome.
All right. We'll go on to 2025. So just some things that you can expect out of 2025. I am responsible for the CHB reporting. I am responsible for the staffing and financing. And if at any time you're wanting to read the results of those reports, I would be happy to share them with you. And then we also do the opioid reporting. I plug that in to remind you that while in my job, I'm responsible for the opioid funding, we decided in 2023 that we would have that particular funding stream always go to a board meeting. So that will only ever be presented at a work session or at a regular board meeting. And so on February 18th, I will be presenting to you an update on the funding with the opioid dollars. And I think that is all that I'm going to talk about. We just are going to continue to try and enhance our partnerships and increase the resources and services that our community members have access to. I should just point out, I have mobile services on there because that's like our bucket list. So if public health had a bucket list, we would have one thing for sure on there, and that would be a mobile unit. So that's like on our dream list. Okay, so that concludes that section of my presentation. Any questions?
Thank you, Mr. Chair. So Amy, what would your mobile unit look like? What is that dream vehicle? Is
So
it like an ambulance or is it like?
it would be some sort of van that would allow for us to do portable health exams. It would allow for us, our biggest one would be for WIC. With WIC moving, so with the change in structure when COVID ended, when they did that COVID unwinding, we used to have the opportunity to do virtual visits for our WIC clients. And so with WIC not being able to be mobile, we have seen an intake or an increase in missed appointments because of transportation. And because people aren't able to get to their appointments, and so then they can't receive that service. And so that would really be what stemmed from the whole like wish list of having a mobile clinic. Is the primary focus would be on putting WIC services in there. But then because we wouldn't need it every day, we would want it to be, have multiple services that it could provide so we could get the best bang for our buck. So whether that's immunizations or health screens, and maybe we have, like we do lead screening and hemoglobin screening. So those are just some ideas.
Any opportunity the
Veteran Services with Shane
yeah.
and his new mobile.
Yeah, that's what I
deal?
was thinking.
I was just gonna ask that if you didn't bring it up.
I wasn't aware of that, but so when one of the services that we did bring into town through kind of a collaboration with ODAM Medical Services was, they contacted us and said, hey, who are people or where are places that would be good to have a mobile medical clinic? And so they were coming to town about once a month, going and sitting outside shelters or like the food shelf. And so because of that partnership, MDH actually reached out to us and said, hey, would you be interested in having a statewide meeting with other counties and just talking about what mobile services would look like? So in the next couple of weeks, we actually have a meeting coming up. But yeah, I thank you for bringing up Shane's. I wasn't aware that he had a mobile
Well,
unit.
he hasn't, they don't have it yet, but it's in the works.
In the works.
They're working
Okay.
on a grant to provide the truck and well, it's like an ice castle
Yeah.
trailer. So it's a
Yeah.
mobile office.
And I do say like it's a dream because I know there's so much that would go into some type of business plan like that. Maybe Commissioner Sumner, you're aware, but Red Lake actually has a mobile unit, but like the logistics of being able to staff it and actually use it is totally separate from the, what we would do with it kind of thing, right? So you hate to spend all that money on something that we don't have the resources for, we don't have the staff for. And really, we would want to guarantee that we, like what we think we have a need for, we actually have a need for. Yeah.
That's
Good
why I think
question.
it could be, worth your time to talk to Shane in the Veteran Service Office and see, because I doubt that he's gonna plan on using it every day of every month, and maybe you guys could share it and make better use out of that. Be certainly worth conversation anyway.
Thanks for the tip.
Yeah.
So yeah, that's it for that part of my presentation. So the next one I don't have a slide for. So the next one is just our updates on our programs and services. And I already mentioned the ODAM Medical Clinic. I just wanted to remind you guys that we do have the partnership with Souls for Souls. So we have 199 free shoes that we got, and we're slowly distributing them to people as they need them. And I think I'm going to save my success story of one of our stories from the shoe for a February meeting. And we're working with Proof Alliance, not super close, but they're providing us with some cool swag so we can help spread education and awareness on fetal alcohol syndrome and the impact that that is having on our community. We have partnerships with several schools, the shelters, the food shelf, Sanford. We had 4 different partnerships through 2024, and two of them are continuing. One ends here in 2025 for immunizations, maternal child population, a community health worker hub, and working on our community health assessment and community health improvement plan. And last year, he attended local public health day at the Capitol. So those are kind of some of our highlights and reviews of 2024 and moving into 2025 with our partnerships. Any questions? Okay. All right. How am I doing on time? We are right on time. Perfect. Okay, so next PowerPoint you're going to have is a community health assessment and the community health improvement plan. And I'm gonna make sure I got my notes right. Okay.
So Amy, just
You will notice,
should your acronyms?
yeah, they're backwards. I did that on purpose because last time you guys were so quiet when I tried to get you to interact with me, you didn't. So there are intentional 5 typos in this presentation. The person who can find them all, I will let you make the agenda next month. Okay. All right. So this is probably one of the bigger parts of my presentation, just because I'm going to do a little bit of backtracking because Commissioner Wagner, I want to make sure you don't feel left out in any information that I'm providing. Okay. So a community health assessment is not just the survey that we do, but it's the collection of all the data that we gather on the health of our county. Okay. So I'm going to make sure I stay on task so I don't run you guys late. I just want to read a couple of my notes. Okay, so the most important thing that I can tell you about the community health assessment is while the board, the community health board, is responsible for creating this document, doing this work, and publishing it and then sending it out to the Commissioner of Health at the state. It's a team project, right? We don't just include how is Beltrami County doing, like the organization, but how is our county doing as a whole? So we did do a survey and we asked people, how do you think we're doing with exercise? How do you think we're doing with parks and recreation? Like we asked big bucket items that focused on those small bucket things. So when we write our community health assessment, which is where we're at right now, we're still working on putting that part of the report together. We need to make sure that we include at least 2 community members or organizations that represent populations disproportionately affected by conditions that contribute to health risks or poorer health outcomes. So that might look like including social services or including someone from corrections or including someone from Sanford Health. And so as we're working on the community health assessment, we've reached out to area schools and we've reached out to Sanford Health and we've reached out to different organizations that primarily specialize or are subject matter experts or have some lived experience in some of these different areas of health in order to ensure that we have a very holistic and collective approach in our report. Okay. Oops. So on this page, you're going to see the list of all of the things that are needed and that we have to address and the kind of the work process. We also need to include one policy aimed at alleviating causes of health inequalities and one policy that illustrates how health equity is included in a goal or a program development. And again, that doesn't necessarily mean that we write something that's focused on just Beltrami County, the organization, but our health of our county as a whole. Okay, so I wanted to make sure that we all have the same definition of health because this is what our work group looked at. Commissioner Wigner, am I saying your last name right? Winger, okay, thank you. We have a work group that the board appointed to help do the work for the community health board, the people that are sitting right here at the table. And so this work group, we've looked at tons of data. We've looked at state data, we've looked at regional data, we've looked at local data, Commissioner Carlson and Commissioner Gasvig, and Ann Linseth, we attended Sanford's health presentation of a survey that they did and gathered all this data. So we're pulling all this data together to help us ensure that health is a state of complete physical health, mental, and social well-being, and not merely the absence of a disease or infirmity. So what that means to me is we're not just looking at how many people have diabetes, how many people have anxiety or depression, but we're looking at what does our environment look like? What is transportation? What is housing? We look at all those areas, and then we're going to focus on 10 key areas. But before we can do that, what are other people doing? So we asked ourselves, what are other people doing across our state, or what are other people doing across the United States? And so Healthy People 2030 were good objectives for us to look at. Now, we didn't look at all of them because Healthy People included 359 core objectives. Thank goodness. We only have to focus on 10 health areas, and then from those have to come up with 2 activities that we want to focus on. Okay. So this just gives you an idea of Healthy People 2030 of some of those key areas that they worked on.
See, Amy, where does the World Health Organization come into this? I see the previous slide, you had World Health Organization logo on there. And why would that be included in this, or?
So the World Health Organization also helps define some health priorities. They set metrics and goals in kind of like the public health world or the medical world, who is very instrumental in setting strategic measures to help us like align as not just a country, but all countries look at who. So I tried to look at different organizations that weren't just Minnesota based, but to look at what we're doing across the United States and across the earth. So that's where WHO falls into that. Healthy people actually comes from the U.S. Department of Health and Human Services. So that was an organization that I mentioned, excuse me, earlier in when I talked about our partnerships, right, and our support. They really focus on disease prevention and health promotion. They have a department that focuses on that. And that's where a lot of these objectives come from, is that department runs that for the U.S. Department of Health and Human Services.
Okay, thank you.
Yes. That was a long answer for your short question. Sorry about that. Sometimes I get so passionate about what I'm talking about that I just want you to know everything that's in my mind. Okay, and then last time I brought up in our presentation, social determinants of health. I want to make sure that's a community health board, because you're going to be reviewing our document and giving us the blessing to move forward on it, and what we present to the public and what we present to the Commissioner of Health at the state, that we're aligned, because social determinants of health are sometimes misunderstood. So our social determinants of health, they have a major impact on the health and well-being of our community. And they focus on they focus on 5 key areas. They focus on economic stability, education and access to education, healthcare access and quality. And then they also focus on neighborhood and the built environment and social community context. So they're not program focused, but they're factors that impact people's health. So safe housing, transportation, education, job opportunities. Okay. So in every 5 years, we have to do a CHB, right? And throughout those 5 years, we come back every year and we say, how are we doing on our current plan? And then in 5 years, we write a new one. In 2020, my predecessor, 2 predecessors, wrote the CHB for Beltrami County. And these were the areas that they focused on. These were in the top 10. Now, I didn't put the top 10 on here because as I'm reading them off, I want you to pay attention to how they align and how they're different to how our work group has picked the top 10. So this year, we are focusing on substance use, abuse, and chemical dependency, safety and security, housing, transportation, education, diversity, equity, and inclusion, access to healthcare, economic opportunity, food security, and health. And health, we're focusing on medical and mental diagnoses, and it includes dental. So it's one big bucket. Okay. And then as I mentioned earlier, Sanford also does actually theirs is called, this is one of my 5 typos. Theirs is actually called a CHNA, Community Health Needs Assessment. They're required to do it totally separate from ours, but a great partner to look at what they're doing and to collaborate on the projects that they're working on, because if we can align our projects, we'll have more success for improving the health of our community. So these were the 2 priority areas that they focused on their last one. And what I found really interesting when we did our survey, so we asked those really simple 10 questions, right? But there were like 6 of them that were focused on like health areas, and then the rest were demographics. So the areas that Sanford Health found in their 2023 survey, and we did ours at the end of 2024, their areas of weakness were similar to ours: affordable housing, daily transportation, safety, childcare, senior housing, employment and economics, and health food access. And the areas of strength that they found from their assessment and that we found from our assessment was environmental health, healthcare quality, current health and wellness, exercise opportunities, and healthcare access. And then just for good measure, so you don't forget, child mortality is the #1 indicator of the health of a community. And as I pointed out at our last meeting, 70 kids out of every 100,000 in Beltrami County die before the age of 20. For the state average, it's 40, and the national average is 50. So we have a lot of work to do, because if that's the first tell of how healthy our community is, that's not very healthy. Then just another reminder, we did our survey, and these were the results of the people that you represent. One of the things that I pointed out at our last presentation, and I want to point it out again, is that safety and security was ranked on the very first column as the second highest thing that people consider important in the safety or in the health of a community. So not our community, but if they had to list things that they thought made a community healthy, safety and security was number 2. And then if you look at the very first column on your left-hand side and compare that, they're saying, well, the health of our community, these are the things that contribute to the negative health of our community and that we need to do better on. And so you can see that that one also made its way pretty high up in the list. And then in the middle column, those are the ones that they want us to focus on. And you can see again, that moves up even higher, safety and security. So I just wanted to point that out, that based on the people's responses, based on our county data ranking, based on all the data and statistics that we pulled, that's how we came up with that top 10 list. And to finalize, so our next steps, we're working on writing the CHA. My hope is that on April 15th, when I come before you again, I will have a draft for your approval of our priorities, our objectives, our strategies, and our activities. And then on July 15th, that's our next CHB meeting. And that one, I'm hoping that we will get the board's final approval because this is due to the state in September. That is it. Any questions?
With all the situations going on with the opioid addiction stuff, is there any talk about any treatment centers starting here? I know there's one that does some with Suboxone, but anything with methadone and things like that to help these people, because there's a lot of people in this area that need help.
I don't currently do a lot of work in public health with treatment centers. That usually falls more to social services. That's where we've kind of parked that category of topic. I can give you a little history on it, but if you would like, maybe I could bring that to then another board meetings where we have more time. Would that be okay?
Sure.
Okay. And then I would probably invite some other subject matter experts like my boss to come and help talk about that.
Commissioner Carlson?
I was just going to let Commissioner Winger know that we have had a couple of meetings centered around the transportation to Brainerd and to elsewhere, and we sort of broached the subject of, well, what would it look like if we had one here, and Ann might be able to address that better if you wanted to answer Commissioner Winger's question.
And I don't know if we have time right now to do too much, but if you want to do something.
Give a 30-second
Give
overview.
a real quick deal there, Ann.
Certainly. Just quickly, I can summarize that we have had discussions around having a methadone treatment center here. We have had one here in the past. So we wanted to be very intentional with that conversation to talk about what would the benefits be, what would some unintended consequences be. And I think that conversation is ongoing at this point in time.
Okay, thank you.
Great. Thank you. That wrap everything up?
That's my
Amy?
presentation today,
And we got our next meeting with you,
April 15th.
April 15th. Great. Anybody have anything last minute? Otherwise, we will adjourn. Thank you, Amy.
Yeah, you're welcome.
Thank you, Chris
for your
and
time.
Ann. Yeah, adjourned until 3 o'clock here for the work session. Take a quick break.